Thank you for joining us this Sunday at 10 a.m. We are talking everything Alzheimer's here in the San Antonio metro area. I am speaking with Meg Barron. She's the executive director of the San Antonio and South Texas chapter of the Alzheimer's Association, born and raised in San Antonio, which is pretty rare. And she has 20 years experience in the nonprofit. I want to say thank you so much, Meg, for hanging out.
No, thanks for having me.
I want to dive right into it and tell our listeners, what is Alzheimer's?
Sure. Alzheimer's is a deadly brain disease, and it slowly destroys memory, thinking skills, and eventually it ends your ability to carry out the simplest of tasks.
Sure.
What is the difference between Alzheimer's and dementia?
Sure. Dementia is part of Alzheimer's disease. Alzheimer's is the most common form of, dementia.
Mm-hmm. So dementia is a side effect.
Exactly.
Sure.
Exactly. And dementia is the loss of thinking, remembering, and I think the most important part, reasoning. Because when you have dementia, you lose the ability to... Well, then you lose the ability to reason, and that scares me.
Yeah, so is there anyone more likely to get Alzheimer's versus someone else, or is it just a crapshoot?
Well, right now, age is the biggest risk factor for getting Alzheimer's disease.
Sure.
And Hispanics are 1.5 times more likely to get Alzheimer's, and African Americans are 2 times more likely to get Alzheimer's. And women are the ones that actually get it the most. 2/3 of those with Alzheimer's are women.
Is there anything that anyone can do to prevent?
Right now, Alzheimer's is one of the top 10 diseases, but it's the only one that doesn't have a way to stop the progression or a preventative method or a cure.
Sure.
So no, but there are
diabetes,
things
you can eat better.
Yes,
right?
About 63% of individuals with Alzheimer's also have diabetes.
Right.
You can limit your risk of developing Alzheimer's disease by eating better,
Sure.
exercising, being social, keeping yourself healthy.
Sure.
And again, 54% of individuals with Alzheimer's also have heart disease.
Right.
So, yes.
So does Alzheimer's happen in young adults ever?
Yes, it does. A small percentage of those with Alzheimer's disease have a genetic mutation. It's called early onset Alzheimer's or familial Alzheimer's.
There's just a movie about
How old is that?
Still Alice?
Correct. And that affects less than 200,000 people. And it is one that is inherited. If you have that mutated gene, you will develop Alzheimer's disease. But the majority of those that develop Alzheimer's are in
How
their...
young do you see that in?
Between 30 and 60. So I have seen people at 32 who have this type of Alzheimer's.
So no one in their 20s has ever...
There is a rare that we've seen
possible.
1 or 2, but it's more common between 30 and 60.
So you really talked about the likelihood of women. How many people total in the United States have Alzheimer's?
5.3 million people have Alzheimer's disease in the United States.
Wow. And how many people does that in San Antonio?
Well, I can tell you in Texas is 340,000. The problem is a lot of people will not go and get diagnosed. They either think this is a common form of aging, or they're scared to go or don't know where to go to get diagnosed. And,
so you feel that it's underdiagnosed?
It absolutely is. And so I would say almost 80% of individuals in our area are not getting diagnosed.
80?
So it is almost impossible to give you a number for this area.
So how much is Alzheimer's costing the United States every year?
Yeah, well, in 2015, it was $226 billion. It is the most expensive disease in the United States.
Why is that?
It's the length of time somebody lives with the disease.
I gotcha. So some cancer, you don't last that long, and Alzheimer's, you can go for a while.
12 years is about average, and with Alzheimer's disease, you need 24/7 care.
24/7, yeah, because it starts to degenerate more and more, and so you're able to do less and less, and so you need more and more help.
Exactly.
So what are some of the risk factors? So we talked about you tend to have heart disease.
Right.
Along with it, you tend to have diabetes.
Exactly.
Along with it.
Yeah.
Is there anything else that might be major risk factors that come?
Sure. Well, again, age is still number one, but
Sure.
yes, not eating a healthy diet, not exercising, definitely increase your risk. But head injuries, we've heard a lot about head injuries, especially with football and the military, both at a higher risk of developing Alzheimer's disease.
Sure. And there's all these movies coming out about this stuff now, slowly but surely. Yeah, like Concussion and Still Alice and stuff like that.
Exactly.
what does the Alzheimer's Association, what do y'all do? How do y'all help?
Sure. We provide a 24-hour-a-day, 7-day-a-week helpline, which is staffed by trained counselors that anybody can call free of charge. I have called it personally, and it is there to help anybody who is a family member who has a loved one with this disease or an individual with the disease who wants to find out resources in their community that can help them. Doctors, elder law attorneys, in-home care, anything like that, that line will help you. And also just if you want a shoulder to cry on, that is the line to call.
So this number that we're talking about is 210-822-6449.
No, that's our local number, but
Okay.
our national number is 800-272-3900.
So
You
the
can-
800-272-3900. They can also get a lot of information at the website www.alz.org
Yes.
to get more information about this. Seems like very underdiagnosed epidemic that's happening to not only Texas, San Antonio, but the United States.
That's right. It's the 6th leading cause of death in the United States.
Awesome. Well, thank you so much, Meg, for coming by and sharing all your knowledge with us. Again, get more information at alz.org. We'll take a quick break. We'll be right back.